Dear colleagues, this is Dr. Hashlamoun, a pediatric dentist from Jordan. I want to present this video for you to know more about nitrous oxide or laughing gas sedation for adults and pediatric patients. Stay with us.
Nitrous oxide on adult patient, even if it's if you can see that it's a pediatric dental clinic, but to easify understanding of nitrous oxide application. There is no big difference between the application on adults and pediatric patients. Now you have to know that this tube is autoclavable. We have to put it inside the autoclave, inside the bag and in autoclave. Now let's move to the knobs. This is oxygen adjustment knob. This one is oxygen adjustment knob. We can increase it by this way. You can see that monitor does not show that there is increase in oxygen flow because the cylinder is disconnected. Now we can see the nitrous oxide adjustment knob. It can be increased till 70%. It's a percentage knob. No more than 70% because delivering less than 30% of oxygen to human body is risky. So as a safety measure, it has not to be increased more than 70%. This is the bag. It has not to be overinflated or shrinked. Its inflation should be directly related to the tidal volume of the patient, and its inflation rate should be directly related to the respiration or respiratory rate of the patient, as what you see here. So let's move now to show you the cylinders. This is the pin that is related to the oxygen cylinder. This is the pressure monitor. Whenever it goes down to 0, it means that the cylinder is empty. We have to check about that. See how it's 0 now. Okay, if you want to fix it to the cylinder, as what you see here. The pin tip is different in its design from oxygen cylinder to nitrous oxide cylinder. This is because of the need for safety. This is the oxygen cylinder, which is white. This is the nitrous oxide cylinder, which is blue. We want now to show you how we can fix the pin of nitrous oxide cylinder. Now it's fixed for oxygen. Let's go for the nitrous oxide. This one is related to the nitrous oxide cylinder. See, we can fix it by the same way, knowing that if we put the same pin for oxygen cylinder, it will not be fixed and oxygen will not go through that. Now it's better to use the soup bubble to check about the air delivery system connection, to check if there is leak. Now the system that we are using, you can see that the cylinder is not rigidly fixed to the monitor, to the flow monitor. There are other systems that that you can see that the cylinder is directly fixed to the flow system. Now we will go to our patient. We will put the nasal mask over his nose by this way. And now you have to see what I'm doing now. I have to fix it from down there. See what I'm doing now? So I'm fixing it to seal his nose to prevent leakage. See, I didn't open the system yet, so patient is using his mouth now to respire air. Whenever I will turn it on, the patient has to use his nose. Now this is output, this is input, this is the in air, and this is the out air. I have to fix the out tube, the outflow tube to the high volume suction. At the beginning, I will maximize the suction to show you how things will go on. Then I have to lower it to a degree that is relevant to the respiration of the patient and to the nitrous oxide delivery system. Flow rate, see what's going on now. The suction is somehow strong. Now it's lowered to a degree that is good for the patient and relevant for the delivery system. Okay. The other thing that I want to tell you about is that we have to put also high volume suction around the patient to decrease the exposure of the exposure to nitrous oxide, to decrease the chronic exposure. It's better to hold it like this. So we have two high volume suctions, one that is related to the outflow tube of the system and the other one which is just near to the patient mouth, rather than the one that we have to use while we are treating his teeth. Now I want to show you how it's hard to apply dental treatment for the upper anterior teeth while we are using nitrous oxide delivery system, especially if you want to give anesthesia in the deepest part of the vestibule. So as what you see here, everything is well connected. Now let's move to the delivery system and show you how everything will go on normally. So this is the system. We have to increase oxygen flow rate. We have to start with oxygen, pure oxygen, for 2 to 3 minutes. Most probably 6 liters is enough for adult patients. For adult patient, we have to monitor the bag to check about our flow rate, if it's okay or not. If the bag is overinflated, we have to decrease it. If the bag is shrinked, we have to increase it. So now, as what you see here, the bag is moderately inflated. Now it's overinflated, so we have to decrease the oxygen a bit, pressure the bag to get air out of it. See, now the bag is moderately inflated. It's related directly to the patient's tidal volume and its normal respiration rate. I will make video cuts. I will go with the scenario that is related to increasing the nitrous oxide 10% per half minute to 1 minute. So see, when I'm increasing oxygen, it's already inflated more and more. Now I have back to lower oxygen flow. See how I'm lowering the oxygen flow. Now I have to pressure the bag to get back to reset its inflation. See what's going on. We are back now to normal. Whenever I will increase the oxygen flow rate, it will increase inflation. Now we will go for nitrogen. We will increase nitrogen now gradually and decreasing oxygen also within the same rate to maintain moderate bag inflation. See, now I'm increasing the nitrogen incrementally. As you see, we are increasing it more and more. You can see the bag inflation. Bag inflation is normal and perfect. And now you can see a bit more inflation than normal. Why? Because I increased nitrogen more and more. So what I have to do now is to decrease the oxygen. See how the inflation is increasing? I have to decrease the oxygen. So I will retain the inflation rate to normal. Okay, decreasing oxygen again. Now I'm getting to normal inflation, which is perfect as what you see here. everything is fine. We have to check about the bag inflation even during our treatment, because the respiration rate of the patient sometimes is different from the beginning to of our work or of our operation, because whenever the patient is anxious, the inflation rate, the respiratory rate is increasing. Now we are now we started with minimizing nitrogen, okay, nitrous oxide, sorry. So we lower the nitrous oxide and increasing the oxygen, as what you see, and returning back to moderate bag inflation. We have to put pure oxygen for 5 minutes, for two important reasons. The first reason is to get the nitrous oxide out of patient's body, which takes 2 to 3 minutes to prevent diffusion hypoxia. And the other cause is the other 2 to 3 minutes that are needed, the rest of the 5 minutes, they are needed to remove the nitrous oxide from the nitrous oxide delivery system to lower the chronic exposure of the doctor. Now, we decreased the oxygen to 0. We already finished. So check about that. There is no oxygen, and patient is getting to be well. Now, I want to show you the pressure of oxygen flush, which is giving positive pressure oxygen to inflate the bag and to get positive pressure oxygen to the human body. Sometimes we need it. Now, we want to check about nitrous oxide and oxygen delivery. The safety system in this system prevents delivery of nitrogen as long as there is no oxygen. See what is going on now. I put oxygen, and now I'm putting nitrogen. Nitrogen monitor is moving. Whenever I stopped oxygen, as what you see here, nitrogen stops automatically. See? I'll stop oxygen now suddenly. There is no nitrous oxide that is moving on to the system. As what you see, moving nitrous oxide knob is not working while there is no oxygen that is entering the system. This safety measure is very, very, very important. Now, the tubes should be removed from the system and inserted in the autoclave. This part should be autoclaved for every patient, as what you see here. Here is the connection. This is the other side of the connection that was fixed to the high volume suction. So removing all of those tubes plus the mask should be applied after completion of the treatment. The clinic should be well ventilated.
If you have any question, you can contact me through WhatsApp or WeChat. I want to thank Guangzhou JR Import and Export Company for sponsoring this video. Thank you and goodbye.